Namaste to all of you. I'm Dr. Balakrishna Gowda, Joint Replacement Surgeon at Apollo Hospital. This is a case of fractured neck of femur, neglected fractured neck femur. He had a trivial trauma 20 days back, unable to walk immediately after the fall. The patient visited many centers to get a surgery done for that. But the only most important thing in that case is like patient had a post-polio palsy, means and the childhood patient got a complete weakness of the affected limb. It is in the different way of doing the surgery. One is like selection of the implants and placement of the cup and position of the stem, and even mobilizing the patient immediately after the surgery also is very challenging. Here we are not thought of in the way of like regular surgery. It was not a conventional surgery. It was in really almost like a revision surgery. The selection of the implant is different in this case. We selected a dual mobility cup. Advantage of this dual mobility cup is that dislocation chances are less and mobility of the limb is good, and even early mobilization of the patient is also possible in the elderly individuals. Actually, this patient immediately after the surgery, within 24 hours we mobilized, and within 72 hours we discharged the patient. The patient visited our clinic within 7 days. He is walking with a partial weight bearing. Even though there is a weakness in the left limb, the component stability is very well placed, and patient is happy to perform their normal daily day-to-day activities within 10 days of his discharge. Thank you.
Namaskar to everybody. I am Dr. Dinesh Tat Sharma, MSc PhD, plant pathologist and microbiologist. I was the retired senior scientist in Central Sericulture Research and Training Institute, Mysore. It is coming under the Ministry of Textile. Recently, I fell down at bank by diagonally because my leg is affected by polio. So all of a sudden, I lost the balance and then got the fracture in my hips. Then I consulted several doctors. Then recently I came to know that Dr. Balakrishna Gowda is very intelligent person in Apollo Hospital. Then I have consulted here. He has told only one thing to me, not asking the 100 questions like other doctors. I am having the 3 methods and take to the operation theatre. Whichever is suitable, I will decide there. So I was very happy for that point. Then immediately I agreed and then admit to the Apollo Hospital, and he has operated me, and now I am very fine, better, and I am walking nicely also and not having the pain. And lastly, I am telling, I am highly obliged to the Apollo Hospital and staff of the Apollo Hospital. My doctor, Dr. Balakrishna Gowda, I am highly thankful, and I did not forget in my life.